welcome. I'm Nira Berry, your host of Happy and Healthy, where we explore and discover all the different ways of keeping you feeling healthy and happy. And remember to watch my Good to Know segment at the end of each episode, where as a life coach, I share with you what I feel is really good for you to know. So today, my guest is someone who really can give us some good tips on living healthy and happy lives. So please welcome my guest today, chiropractor Dr. Michael Moskowitz.
Thank
welcome.
you for having me.
How are you doing?
I'm doing great. How are you?
Good, thank you.
That's
thank
good.
you. So tell me a little bit about yourself.
Well, I've been a practicing chiropractor for over 30 years in Bethesda, and I have a family practice, so I've taken care of newborns and 90-year-olds and everyone in between. I've done a lot of athletes, professional athletes, and the local school athletes. I am certified in a number of chiropractic techniques, which I'll talk about later.
Aren't you on the state board?
And I'm also on the State Board of Chiropractic in the state of Maryland.
Okay.
Which is an interesting experience.
Yeah. So tell me, what inspired you to become a chiropractor?
Well, when I went to the University of Maryland many years ago in the 70s, I actually started running, and I had terrible leg pain. And I eventually went to an orthopedist, and he told me I have shin splints. And I did physical therapy and a number of other things.
I've had those too.
And I went home, and my dad told me there was a chiropractor in town, which I didn't know much about. And he lined my low back up, and I never had shin splints again.
Wow.
So I was very interested, and I learned about it, and I went to visit my cousin who was in chiropractic school, and here I am.
Yeah. So one thing that I've learned about you is that you're actually more wellness-oriented.
Correct.
Than just like the average chiropractor, which I find really interesting.
Correct.
So can you tell me about that?
What we try to teach our patients is there's 3 factors to your health. There's chemical, which most people know about, nutritional, what you eat. We also have, in fact, it was in the Washington Post health section the other day, there's an opiate problem, people with drugs and pain.
Yeah.
So that's an issue
really
that people
big
need to
issue.
deal with. Of course, smoking and all those type of things. So that's one issue. The other issue is what you deal with is mental. People who are happier, they sit up straighter, they exercise better and all those type of things. They sleep better.
Yeah.
People who don't, they slouch and those sort of things. And the last is physical, which is where we come in. So there's 2 types of physical. Obviously, if you break your leg or you break your arm or you have something terrible happen to you, you'd go to an emergency room or what have you. The other is chiropractic, and that's what most people don't know about. So I'm going to bring my spine right here and talk about it a little bit.
Yeah.
So the spine is your lifeline. The nervous system, which sits in the spine, is the only system in the body that's encased by bone. There is no other system in the body that is protected completely by bone.
I never knew that.
So your nervous system is vital. The spine has a number of functions. First is to protect the nervous system, obviously. Number 2, it has a mechanical function, meaning if you're going to throw a baseball, it just doesn't sit there, it has to move. So it has joints, it has discs, it has ligaments, it has muscles, all those type of things.
Fascinating.
So, yeah, it's really cool. So what happens is it has to have a certain alignment in a neutral position, meaning when you're standing, when you're sitting, when you're not playing sports or you're not doing anything physical, but you're just sitting at a computer or you're reading a book or you're watching TV or you're just walking, it should have a basic neutral posture. And from the side, it should have certain curves, and from the front, it should be straight. Any deviation from that is going to give us problems. The reason it gives us a lot of problems is we are never, ever not dealing with gravity. You can't avoid gravity. So as NASA's found out, they send people to space. If you ever saw it in the paper a few years ago, they sent Gabby Gifford's husband's twin brother up into space. I think Gabby Gifford's husband was here, and they did tests on him. They sent him to space for, I believe, a year, and he came back, and he lost his alignment. He was completely straight from the side, and he had a number of health issues, not just back pain, but blood pressure and breathing and all those type of things. So that's why I preach wellness, because not only can chiropractic take care of a bad back or herniated disc. For example, I had a patient who was a war hero. He ended up being a prisoner of war for many years, and he had a terrible herniated disc. In the VA, he went to the VA and they said, you need an operation. One of his friends brought him to me. We did some chiropractic care. I'll talk to you about some of the different things that I do. And he never needed the operation, so it was very cool. I had a patient many years ago. She was a professional ice skater. She was ready to go to the Olympics. She was that kind of class. And she ended up having leg pain. Of course, everyone thought it was a disc or whatever. It turned out to be multiple sclerosis, which is pretty serious. And they thought she'd never skate again and she'd never have children. She was only in her 20s. And I started working on her. And she's now in her late 50s. She's still skating. She had 2 kids. And she's doing extremely well. Wow. So that's because the nervous system is what gets us in trouble. The nervous system, if it's irritated in any particular place, or it can be a number of different areas, will affect our health. And in chiropractic, what we do is we look at your spine, we look at your posture, we look at your mechanics, and we use something called mechanoreception. So because of gravity, we are moving all the time, and the brain needs to know where we are in space. And these are special nerves in the body that tell us where we are in space. So, for example, when we're sleeping, that's why you need a good bed. Right? Yeah. If you didn't, you don't sleep because, you know, your heart's slowing down or you're not breathing as, you know, like you were exercising. You need it because that receptors are always telling you are in space.
And
so
I know that you mentioned like that it can affect like certain, you know, you can get like asthma that you can help, and what other type of
correct.
Health concerns?
So the first 3 vertebrae in the neck, they actually are connected to areas in your brainstem. One's called the nucleus tractus solitarius, the other is the trigeminal nucleus. Okay. So it's almost like those 2 are like Metro Center and Gallery Place in your brain. And, you know, nerves are coming in and out, and, you know, different trains, you go to the yellow line and what have you. And that's how your nervous system works. Information's coming in. Your brain decides how important that information is. So, for example, pain's very important. If you hit your hand, that would go to your brain. But mechanoreceptor, posture where you are in space, is always going to those areas. And those areas are talking to everywhere else. How you breathe, how you digest food, your blood pressure. Even when you take vitamins, which are very good for you, your vitamins have to go somewhere. Those areas have situations where you have certain blood vessels. The nerves that control those blood vessels, if you're out of alignment for long enough, they'll squeeze those nerves. They're called sympathetic fight or flight nervous system. So you won't be getting enough oxygen to your tissues. And the whole idea of vitamins is bringing those nutrients to help oxygenate and make you healthy. Same thing with exercise. You want to have as much oxygen as you can. So if you're going to run a marathon, you want to be able to recover. So that's why a lot of athletes come to me, because we make sure their spine's right, their mechanics is moving right as they're running, and they're also breathing, and oxygen and everything else is doing much better. Interestingly enough, also how you think. So the area of the brain called the cerebellum, where those receptors go that do the mechanics of the body, they're also the emotional centers. They've done studies where they take a group of kids in one room and another group of kids in the other room, and the one group takes a test, and the other group actually moves before every question. They do better because movement helps the brain and helps how you think.
You know, I've heard of that. I know that with movement or with laughter and being able to get more oxygen into the brain, that it helps you think better and be able to access more information through your brain.
Correct. And that's why we try to put all 3 factors together. Because if you're just doing one, it may be a problem with the other. So if you're exercising and you're eating chocolate donuts and coffee all day, kind of doesn't go together, you know? So you want to keep that. Also, people who may not be happy with their jobs or something like that, you know, they slouch. That affects their spine, that affects their breathing, and it affects their attitude.
Yeah, or sitting by a computer and just hunching over.
Correct.
Or like where you see, you know, everybody nowadays just with their, you know, tablet or cell phone.
Correct.
Like everybody's like this all the time, and we forget that we have to be more, you know, upright.
Yeah, I get a number of high school students, and their parents bring them in because they're like this all day on the cell phones. And they can't believe that their children at that young age are slouching.
Yeah.
So we do not only chiropractic, but we give them some specific exercises that we'll show you later that we actually can diagnose and say, okay, this is how you prevent it for the rest of your life, which is very important.
Yeah, that's great. That's great. And so it sounds like you can really help with a lot of different things, like asthma, as you mentioned, and allergies. And,
Correct.
And what are some of the
there's a lot of great studies. Actually, at the University of Chicago, they did a study on blood pressure, that those first 3 vertebrae in the neck will help lower blood pressure so people don't need as much medication. They may still need some, but maybe not as much as they originally needed. And that's the big thing, is chiropractic is more of a wellness situation after, if you hurt your back or your neck or what have you, you want to get rid of the pain, which chiropractic is very effective. On all the studies are tremendously effective. But it's also good. I have people that come in as a maintenance in the wintertime because it helps clean their sinuses. So I will have a patient that didn't even tell me they're having a sinus problem, and they'll get off from the table and go, oh my gosh, I need a tissue because it's draining my sinuses. I had a 2-year-old boy once that had ear infections for a year or two, and they were going to do an operation. And I said, well, give me just a couple weeks. And within 2 weeks, he never needed the ear surgery for his ear infections because it kind of opened everything up. And
I've never heard of that.
Yeah,
That's amazing.
it happens. That's pretty common in chiropractic.
That's really amazing.
With kids in ear infection, kids in asthma, there's a lot of that.
And also involved. With the blood pressure, because really the trend now is to really be proactive in wellness and to really be on as little medication as possible. And there's like many different techniques that people use, whether or not it's meditation or laughter, but this is really great adjunct to living a healthy life, and it's something that sounds like it's really a key factor, especially for staying off of medication if possible, or avoiding surgery.
Yes, it's very rewarding. It's really
important.
Cool. There's a lot of studies with exercise, and of course, like you did, laughter, that show that it increases people's health potential, immune system. And when we're doing an adjustment, well, I'll show you some things in a few minutes, we actually work the small spinal muscles that are very important because, again, that brain needs to know and get that feedback mechanism.
Yeah. Wow. Well, that's really all really good stuff to know, and I want to hear more. So thank you so much. And we're going to take a quick break and with my guest, Dr. Moskowitz, a chiropractor. And I'm Nira Berry, your host, and we'll be right back.
I already knew that I was going to go to college, from a young age. I definitely want to major in political science, become the mayor or something, make the situation better for other people. My name is Justin, and I am your dividend.
Hi, welcome back to Happy and Healthy. I'm Nira Berry, your host, and we're talking with chiropractor Dr. Michael Moskowitz. So let's continue. One of the things that we were talking about is all the different things that you could help people with. But when should somebody really come in and see you, get chiropractic help?
Well, one of 2 ways. One is obviously if you're concerned about your posture, your alignment, or your child's alignment or a friend's alignment, also what you're doing at work. Or you could come in for wellness, just to be checked, even if you're feeling pretty good, to see what your alignment is. So, for example, if people are on the computer all day, they might be worried about their posture. A lot of people have head-forward posture, which we do certain things, which I'll talk about in a minute, to correct. Kids with the cell phones, kids with the backpacks. As you get older, the spine compresses a little bit, especially if you're not in alignment. One of the things they've researched is if you're in a better alignment, you don't get the degeneration and the arthritis as much as people who do. You add that with exercise, and that is fantastic. And
do you recommend certain exercises?
Correct. We give people exercises. I do work with trainers, many trainers in the area, and physical therapists. So we try to get people going. So as you get older, you want to exercise a little bit more because you're not as in shape, particularly as we were when we were in our 20s. So,
but exercise smarter, not harder
correct,
necessarily.
Correct, exactly. But that's why sometimes it's good to have a trainer or a physical therapist, even if you just go once or twice, just to get the general idea of what you should do and what you shouldn't do. People do. We go over that in my office. But the big thing is that as you exercise, as you get older, you need something to help you recover more. So the chiropractic is great for that. We do talk about certain stretches and exercises and postural things, core exercises, planks, things like that. So when you're, if you're just sitting or you're on the cell phone too much or you drive a lot or you're exercising a lot, no matter what it is, you don't have to have symptoms to come in. We can line you up and try to do a better wellness program for you.
So what would be like some misconceptions that people might have about going to see a chiropractor?
Well, one of them is you have to wait till you're in pain. That's not necessarily true.
So you want to preempt that.
You want to preempt that if you can, just like anything else in your life, exercise, eating well, laughing.
Yeah.
The other ones are that you can be any kind of injury, which is not true. They've shown that you can't really hurt any particular part of the spine. Some people, as I'm going to show you some of the things they do, may get sore after an adjustment. It's like an exercise sore. You're working muscles that may have not been doing a particular movement for a long time. So for example, let's say you came in and 10 years ago you had a whiplash accident.
Yeah.
Well, over the 10 years, there's scar tissue, bad posture, the discs will degenerate. To get that going again may be sore. Sometimes it's painful, but it's very short-lived.
Yeah.
And as you work through the chiropractic and the exercises, everything kind of goes in the better direction because, again, you're healing the area more permanently and not just looking for symptom relief.
Yeah. So how long should somebody expect to have to go see you? Like, it's obviously not just like a one-time thing.
Correct.
Like, is it typical to see you for 6 weeks or how
A,
often?
it depends what you come in with. So
Yeah.
I have people that come in that have had a history of a whiplash, a history of a fall. They might have a hip replacement, and everything's kind of not balanced. Those things, or they have arthritis or a herniated disc, they might take months, if not years, to fix. Some people, like young people, they get fixed up so quickly. They don't have arthritis. They don't have the long-term bad posture. They might be a couple weeks, and then we'll recommend a maintenance program because they're playing lacrosse or they're soccer. I'm always concerned about the young kids playing soccer and the heads. I don't know, they call it headers or what have you.
Yeah, when
they bang heads or they
yeah.
they can get a little bit of a problem with that. I know there's a lot of studies with concussions.
Yeah.
So I had, about a year and a half ago, a professional football player came in, and he had a concussion. And I did a special move on him, and his concussion went away, and he played the whole football season.
Really? Wow.
Yeah,
Because I
so
hear a
that
lot
was-
of people getting concussions
Yes.
and
Yeah, a lot of, especially
And it takes a long
teenagers,
time.
and you have to be very careful. I do work with a neurologist because
Yeah.
we want to make sure everything's okay. Of course, the football player, they had their own neurologist on the team. So the bottom line is there's a number of reasons. Some people do come for a short time. I had a patient this morning that drove here from St. Michael's. She
Wow.
had a major head injury about 5-6 years ago. Tremendous balance problems, a number of health issues with her eyes and
Yeah.
so forth. She did have brain damage. And when I adjust right up in here on her on the right side, her balance gets better. So her caretaker brought her here this morning. They drove all the way from St. Michael's.
Wow.
And I worked on her, and they turned around and drove back because a special few things that I do that really helps her.
So that's amazing that she even knew to come to you for that, because I think there are a lot of misconceptions about chiropractors that you go in like for an adjustment, and a lot of people are like afraid of that term alone. I know,
Correct.
like that can
Correct.
that can
Sure.
scare people away.
Sure.
But it sounds like you really, from what I'm hearing you say, is that you do so much more and you help with so many other things that.
Correct.
It's not you're not like it sounds like that it's really the whole field's has come a long way.
Correct. It's come a long way. I do a special technique. I'm certified in this instrument. It's just light pulses. I've done this on babies. That's how light it can be. There is a switch for adults and
Wow.
bigger people and so forth. And you plug it in, and it pulsates. The reason is if you have, let's say, a head forward posture, and you go to just turn their neck, you might get some results that they'll feel better, but they're still going to walk around with the head forward posture.
Yeah.
So I have a special table that brings the head up. We tap the vertebra that's out, firing those receptors, talking to the brain.
Yeah.
We also will give them exercises. We also have these type of blocks. These are very specialized. They
Wow.
make them in Australia. There's a chiropractor in Australia that invented this.
Wow.
It is one of the most researched things in the world. Their PhDs and MDs in the University of Cairo are researching these for dizziness, fibromyalgia, herniated discs, nervous system problems, a lot of good things. And what you do is you lie back on it.
Do you sleep on it?
You don't sleep on it. It's an exercise. You
Yeah.
probably have to be on the floor or with a mat, and you would lie on it. We build people up in the office so they can do it. It's harder than it looks,
Yeah.
especially if your neck is out of alignment. So if you have that head forward posture, we take an x-ray. There's a number of things. These vertebrae here might not be so bad, but these guys are bad, so you put it lower. Opposite thing. These guys might be okay, and the top guys might be bad.
And so what would
we
be
put
the final
block.
goal of that?
The goal is to be able to re-x-ray the patient and see them in perfect posture. So
that could happen, really?
I had a patient just the other day.
Up
She's
in-
actually, of course, people go in and out of the country here. She's leaving the country and going to Germany. She's been with me between 6 and 8 months, and she did not only the block, but she did something where her head hung off the table with a weight, and we re-x-ray and it's perfect.
Wow.
It's literally her head, her skull, and the vertebra are all where they completely should be. And it's very exciting when that happens.
And can you do that, like actually make a change like that in somebody's, vertebrae, even at an advanced stage? Or
You
is
can do it at
limited?
advanced stage. You may not get 100%.
Yeah.
You can make changes. This is
improvement.
shown. It can definitely make improvement. Again, I have other things. For example, if you want to try it, we have an exercise strap for people who are like in a whiplash or they're on a computer a lot. And some people come in and their head's not forward, but the neck's completely straight from the side, which is not very good. So we have them take the strap. Again, we've seen the x-ray. We know what vertebra we want to be on. We take it. We stretch it out. This is a little tighter one. Stretch out like that. And then we're going to have them exercise like this.
And they pull their head back.
Correct. And they resist back on it. And they do that for about 20 seconds until that feels comfortable. Then they can do it a minute. That's a little bit lighter strap. This is a little bit stronger strap. So if that becomes too easy, they can do the more stronger strap.
And how long do they do this for? Like a month?
They can
6
do
months?
that forever if they want.
Oh,
So
really?
if you're on the computer and you want to bring it to your office, you can take it to your office. You can sit there for a minute, stretch, and then go back on the computer. What you do is you're changing the ligaments that hold that spine. We're really always changing ligaments. Muscles are kind of secondary players. They're important. Ligaments are the big players. They have the receptors. The joints have ligaments. The discs are sort of ligament-type material that have the receptors. You want to work those. Those are
That's
the
so
hard things to
interesting.
correct.
So interesting that you can actually correct it.
Correct.
Things that you wouldn't think that you can do. So let me ask you, at what age span, range do you see people?
I have newborns and I have little people, 2-year-olds, 4-year-olds, high school,
Some
and then I have
newborns.
some 90-year-olds.
Wow.
And some of them are pretty amazing shape. I have a few 90-year-olds that they're out exercising. They're very active, and the chiropractic helps them keep going. It prevents injuries. I have a gentleman who actually is a Holocaust survivor. He's in his late 80s, and he gets cramps in his legs when he works out and exercises. When I adjust him and work on him, he can go back to exercising.
Wow.
So it's very exciting.
And that's important if you can help somebody keep exercising, because then they will become more mobile, and the more you are that way, the more your breathing helps, and you're able to live longer than sitting and having to be in bed rest,
Correct. Believe it or not, someone just gave me a book by a PhD at NASA, and the whole book cover is just the chair saying, "Don't do this." So
well, that's what I've heard.
Yeah.
That sitting is like the new smoking. Like you're not supposed to sit all day long.
Correct.
Yeah.
Get up and move.
Yeah.
And that's why a regular exercise program that works for you, and just trying to move, just walking, or some people use the elliptical, or just even the bike is great.
That's great. That's really good information. So if somebody wants more information, how could they contact you? Would you mind giving us your website?
We have a website. It's Chiro5415 at AOL.com.
Okay, great. And if I'm just curious, like, do you exercise a lot yourself?
I exercise.
And
I
do you
walk.
get injured ever?
I've gotten injured, that's for sure.
And what do you do about it?
I get adjusted. I am very lucky. My daughter just graduated chiropractic school, so I am very lucky. I get personalized chiropractic, so that's really good. And I stretch.
Yeah.
And I take vitamins, and I try to meditate. Of course, that takes a little time, so some days that works better than others. Yeah. But it's very important. I think getting a good night's sleep is very important. And I think having a good attitude is very important. So we kind of preach that in our office, that's very big deal, and it helps your health overall.
Yeah.
I've had a patient many years ago, and she would walk in and kind of mumble and whatever, and I would adjust her neck, and she would come out with a smile on her face, and it just made my day.
Yeah,
and it really made a big difference.
I was going to say it must be very rewarding to help so many people on so many different ages and with so many different issues.
Yes.
That's really wonderful.
Yes.
So I thank you so much for being my guest today, chiropractor Dr. Michael Moskowitz. And I'm Nira Berry, your host of Happy and Healthy. And stay tuned, because we have another segment coming up called Good to Know, where I share with you what's good to know. So thank you for watching, and stay tuned.
If you store your guns properly,
I'll feel safer when I'm playing outside.
Safer when walking home.
And I won't have to tell my kids, this isn't a drill.
Never let your gun get into the wrong hands. Always lock it up.
Hi, welcome. I'm Nira Berry, life and happiness coach, and your host of Happy and Healthy. And now it's time for Good to Know. And today I wanted to speak to you about habits. And one of the things I learned when I was in grad school, for health and wellness coaching, was that we can actually replace bad habits with good habits. And it's so interesting that our brains are very moldable, just like plastic. And I actually call it the plasticity of our brains. And, people always say, you can't teach an old dog new tricks. But it's not the case, actually. So if you have a bad habit, let's say you react to thing in a bad way, or maybe you have a smoking habit or overeating, and something that bothers you that you want to change, you can actually make a change. The bottom line is, if you're not happy with how your habits are, you can replace them with a good habit, because your brain can create new neural pathways, and you can have a new habit that'll make you have a much healthier and happier life. So thank you so much for watching Happy and Healthy. I'm Nira Berry, the happiness coach. And if you have any questions or want to contact me, you could reach me at happyandhealthytv@gmail.com. So thanks so much, and have a happy day.